year marks the 30th anniversary of the publication of the first American College of Cardiology and American Heart Association clinical practice guidelines on the indications for pacemaker insertion. Since then, fueled by a shared sense of responsibility to translate evidence into clinical recommendations to guide cardiovascular clinicians, the ACC and AHA have developed 23 clinical practice guidelines across a broad spectrum of cardiovascular disease and procedures. And I think that the underpinnings of this core initiative for both organizations is the internal mandate to continue to evolve the process and the methodology that allows us to evaluate and incorporate the continuous stream of new evidence so that the guidelines remain current and they remain relevant and they remain useful at the point of care. Some of the new changes that are currently being implemented include the addition of a separate process to perform a systematic review of the evidence, the creation of an evidence review committee that is separate and distinct from the guideline writing committee, the addition of lay representatives on the guideline writing committees, the expansion of the peer review process to lay constituencies as well as government organizations when appropriate, and an accelerated publication release. Future guidelines will address cost effectiveness and value of various interventions, will have an integrated approach to comorbidities as the population ages and people live longer with more chronic disease, and will address or try to harmonize with other organizations that develop guidelines so that we increase the consistency and the adherence to guideline recommendations. Looking ahead, it is clear that guideline methodology will continue to evolve in response to a changing healthcare environment and the availability of new formats with which to deliver our recommendations. Continuous living documents using various digital platforms are currently being developed, and embedding guideline recommendations and prompts into electronic medical records and into mobile devices accessible at the point of care will no doubt require rethinking of how we parse information into individual bytes of data that will inform individual recommendations. However, what I think will remain unchanged is the steadfast commitment of both organizations, the American Heart Association and the American College of Cardiology, to deliver evidence-based recommendations that guide clinical practice to improve the quality of care and outcomes for our patients with cardiovascular disease.